Archives of Prasar Bharati presents the timeless treasure of golden era.
Institute of Neurology in the 70s was one of the most important centers for all neurosciences in the country. We had teachers and scientists from all over India visiting the institute and spending a month or two with us. In addition, we had at least 2 or 3 foreign guests from almost 70 countries in the world during from 1970 to 1978.
Was this the first institution of its kind in the state or in India?
This is the first institution of this kind in the whole country, where all the branches of neurosciences like neurosurgery, medical neurology, neuroophthalmology, neuropsychology, neurochemistry were all combined and put together. Of course, following this, there was the Bangalore Institute, National Institute of Neurosciences, created by Dr. R.M. Verma, which is now going on very well. So, in these foreign guests, we had people from China, from Russia, from Poland, all those so called Iron Curtain countries also used to come and visit us. And this increased our international cooperation. And I was able to send many of my students and students from other parts of India to various centers in the world for further training, including Japan, Soviet Union, Australia, of course UK, USA, Germany. So it was a very satisfying situation, and I had with me excellent colleagues who were experts in their own field. In surgery, I had Dr. V. Balasubramaniam, Dr. S. Kalyan Raman, and Dr. Kanaka. These were the 3 outstanding neurosurgical colleagues. And in neurology, that is medical neurology, we had Professor Arjun Das, Professor Jagannathan, Krishnamurthy Srinivas, and Zahid. You know, it was a big circus. It is consisting of lions and tigers and elephants and all that.
Why do you say that, sir?
Because each one was independent. Each one was excellent in his own field. And therefore, to manage the whole lot as a circus manager required a lot of expertise from me. Thank God I had it.
You didn't have to crack your whip now and then.
Occasionally it was needed, but each one, had to be developed in his own field. Then only the best could come out of them. There was no conformity in the institute. Each one was allowed to do his own idea, way of thinking, produce his own results, and the idea was the excellence of the institution and good to the patient. And therefore, it was quite an exciting, and we had a number of research schemes. One of them was in collaboration with the United States on epilepsy, and we had a big scheme on that to study of epilepsy in India. And Professor Earl Walker, one of the senior most neurosurgeons of the world from United States, was our guide. We had almost 20 research schemes going on at each single time in the institute, and at least 200 research papers were published by all of us. In this connection, I would like to say something about the specialty called stereotactic surgery. This type of surgery is one where you make only a small hole in the skull, not a big operation, and put a fine needle to a definite predetermined spot, and by injecting a medicine there or destroying it, you can create improvement. For instance, in a disease called Parkinsonism, what's called shaking palsy, where the hand goes on trembling, we reach an area in the depth of the brain and make a small operation, and the trembling will stop. But the difficulty is to navigate your needle to the correct spot. It is like navigating in space, in outer space. This is inner space, the brain. This surgery in our department had a dramatic start. This was a little earlier, in 1961, when I had a call from the governor of Andhra Pradesh asking me to come over to Hyderabad to look at him. This was General Srinagesh. Both of them, his wife and she, were very cultured people, very highly cultured, dignified. And I was the guest at the Raj Bhavan. And I arrived in an evening. I remember the old customs. Nothing of the disease or business was talked about.
I see.
When we went there, we had hospitality. Then we had a very nice dinner. Only the three of us served with all the silver cutlery and china porcelain and all that. Very elegant. And after dinner, over a cup of coffee, the governor, we were sitting both of us. Then he started his story. He told me he had Parkinsonism. Of course, I could see it the moment I met him. And he said he had been operated earlier in London and whether I could do the operation in India.
But you said he had already been operated upon in
Once,
London.
on one side. You see, we have to operate on two sides. So I said, fine, I can do that, but the problem is I know the technique, but I don't have all the necessary facilities, all the small things that make for success. He said, fine, then what should we do? He said, should I ask those people who operated on me in London, come over to India and operate? I said, that will be an excellent idea. They can come to India and stay for 2-3 weeks and bring the instruments with them, and I will collect a number of neurosurgeons in India. They can all gather and learn the technique. And he said, fine, I can do that. And I was very, very happy. Then I thought I'll be leaving next morning and something will come. But you know what happened exactly? He took the phone next to his sofa and called Delhi and asked for the Prime Minister.
See.
It was 11 p.m. in the night. And he could get through to Jawaharlal Nehru in about less than a minute. And he told Panditji, this is the problem. I want this type of brain surgery to be started in India, and Professor Ramurthy is here. And I want your permission to do. There was a Commonwealth scheme. And I couldn't hear, of course, what Panditji said. Obviously, he agreed and asked him to go ahead. So General Srinivas said, now the PM has agreed and I'll get in touch with you. And within 3 weeks, he was able to arrange the whole lot. And we had this wonderful team, Dr. Dennis Williams and Mr. Walsh, both very well-known neurosurgeons of those days. They spent 3 weeks with us in Madras, and a number of neurosurgeons had come, and we had almost 40 to 50 patients from all over the country because this visit was well publicized. So we could choose the best cases and operate, and that was a very enlightening period. And the point was, this was a takeoff point for us. What we learned from them was only to operate for Parkinsonism, or one particular disease. But in our department, we used the technique to deal with 100 other conditions.
How successful was the surgery?
Excellent successes. If you choose the case properly, as soon as the moment you make the lesion in the brain, you can see the tremor stopping. It's immediate. So actually the patient goes on talking, and it is done under local anesthesia, and you ask him to show his hand, spread out his hand, it will go on trembling, and you make the operation, immediately the trembling will stop. You can see it. Then only it is successful.
What is the risk involved, doctor?
Very little risk. There was about 1% risk of paralysis developing. And that paralysis also is only temporary. Of course, it implies that you are absolutely accurate. I mean, silly surgery will give you silly results. That is accepted. When you talk of risk, you must talk risk of only the best performed surgery. In any field, it is so. When you do a thing excellently well, is there any risk? If you do it badly, there is a lot of risk in anything. So we extended this field to treatment of epilepsy, treatment of pain. Is unbearable pain. Cancer patients sometimes have such severe pain that life becomes hell for them. And they are willing for any type of relief, and we could make an operation in the center of the brain which perceives pain, where all the pain sensations concentrate in one area of the brain. And if you destroy that area, then they won't feel pain from that part of the body. And that was a very good thing for the patient because they had very good relief. Of course, they lived for about 6 to 8 months afterwards because the cancer took them away. But till then, they had a comfortable life. They had a comfortable life, and their relatives, people who look after them.
Yes.
You see, in medicine, you must remember, you are not only treating the patient, but you're treating the relatives, because the anxiety of the relatives, a wife, a husband or a child suffering from pain, induces enormous amount of tension, anxiety, and worry on the part of the husband, the mother. So the doctor should realize it. It's a pity that this is not stressed in training nowadays. Get to the relative's mind, reassure them, and see that your patient gets the best. Then they get relieved. So this is one of the most important things in this pain surgery, that you are treating also the anxiety of the carers, the people who look after. Then we took it on to psychiatric diseases, mental illnesses. We have done a number of operations. In fact, I presented a paper on this in Moscow and Leningrad, because the Soviets were very much interested in this form of surgery, because the stresses in that system were so much that a lot of psychiatric problems were there. The indications were very clear. You see, we used only for two types of cases, and when there is one severe depression is one. The other one is what's called an obsession. The person goes on washing his hands, or goes on turning the lock to see whether it is closed or not, and repeats, going on repeating the act. Only these two did very well from our operations.
You mean even depression can be treated
Yes,
surgically?
severe depression, pure depression is excellent results.
But that is, you're talking about prolonged depression.
Yeah, it's
not-
always treated earlier by psychiatrists, and when they say it is difficult to treat and the drugs have not been helpful, then we operate.
What kind of operations?
It is again stereotactic surgery. We direct the needle to the front portion of the brain, which is responsible for our thinking, judgment, and all that, front portion. And that is not working properly. You see, the circuit is interrupted badly. That's why there is depression. They don't see the reality, but they go into an unreality and get depressed. So you can release it. This sort of operation. Depression will disappear on the table when you operate. Patient will say, a load has been lifted off my chest, he'll say.
See. But what about the quality of life later on? Does
Oh,
it
the quality
affect
is not-
other functions?
Oh, there are people whom we have operated who are now High Court judges, great lawyers, engineers, administrators.
Why is
businessmen.
it that this aspect has not been publicized?
It is known all among the medical people. There is no difficulty. All psychiatrists
But
know.
then lay people should also have access to this kind of knowledge, because most of them go to psychiatrists. They don't
No,
seek-
they should go to psychiatrists. It must be understood that only when medical therapy does not help, this is useful. Medical therapy, psychiatric therapy helps in about 90% of patients. Some become intractable. In those cases, specific operation, correctly done, definitely relieves. We have operated on hundreds of patients.
What about
This has
schizo-
all been published in the world scientific literature. See, we do not go, I especially discourage people going into the press and trying to make a drama out of it. Of course, scientific information should be known to the public, but dramatizing small successes harms the public as well as the science by claiming something that is not true. Oh, I cure cancer and all that. How many people get disappointed? Because you are not really curing. If you can cure cancer, you will get a Nobel Prize 10 times over. So this is well-known knowledge among psychiatrists. We get cases referred to this.
What about schizophrenia?
No, this is not useful for schizophrenia. The problem of schizophrenia is entirely different. It is a chemical disturbance in the brain. We have to approach it from a chemical point of view, not from an interruption of circuits. Then we took it over to addiction. We treated a large number of people who are addicted to drugs like morphine and pethidine. Especially nurses and doctors sometimes, get used to this, and pethidine or morphine is easily accessible to them, and they get addicted and their career is gone. And some students, we found very good success with morphine and pethidine. So why not we try it for alcoholics, chronic alcoholism. We tried that. What happened was we had equally good success with alcoholism as with other addictions. But majority of them went back after about 3-4 months. Because you see, alcohol is accepted in society, whereas morphine and pethidine injection not accepted in society. So what happens after 2-3 months, this patient, oh, doesn't matter, the so-called friend Have a small drink, it's not going to harm you. Those idiots don't know that they are again putting him down along the. They are not friends, they are foes. But this is what happens. So we stopped doing it for alcoholism because it is not really helping the patient. So all these research, number of PhDs were created in those days. They all got their PhD in many aspects of neuroscience. And till 1978, I think I retired. In those days, the doctors had to retire by 55. I think at that time, the advisors regime was there. They gave me an extension of 1 year, 1956. 1978, till the age of 56, I retired in. In the meantime, I became the principal of the Madras Medical College. Being the senior most in service, I was asked by Shaw, who was the governor, to become the director of medical education. He said, I will give you all freedom, we will not interfere, do what you like. But I told him, I said, sir, no, I will not take it. Because it's okay, now there is governor's rule. Soon there will be election and these MLAs and all that will come. Nowadays, when any MLA comes, he does not sit in front of me. He stands and talks to me. If I become the DME, I will have to stand when he comes in. He will order me what I should do. I said, I will not do it. Then he said, all right, next is the principal, you have to. So I took up as a principal, not as superintendent of the hospital. Principal in those days meant only academic. And I was able to do a lot of good things during those 2.5 years as principal. The real thing I created in the students and staff was a pride in the Madras Medical College. See, the Madras Medical College is the oldest medical college of India, started in 1835. And its alumni for 150 years have occupied, they're all glittering stars in the firmament of medicine. Majority of them. Till very recently in the past 20 years. Even now there are many, many good people. The majority have been from the Madras Medical College. So I created that pride that this is an institution which has got a tradition, a glorious tradition, apart from so many other things. So because unless you have a pride in an institution, for instance AIR, it is doing so much, you must have a pride in belonging to the All India Radio. Same way, in any institution, it doesn't matter. Unless you have pride in your institution, you will not get excellence out of people. I'm only talking in a general sense. I don't want to go into the details of what I did for the medical college. I revived the games, then did a lot of things for the National Cadet Corps. By the time I was made a brigadier of the armed forces, because I had helped the armed forces on 2 or 3 occasions. Before that, I'll go back again. One evening, this was much earlier, it was in the 60s again, call came from the defense minister's office saying that Krishna Menon wants to talk to you. So I talked to him. Not met Krishna Menon, of course. He was too big a figure, too remote. And he was the defense minister. And he told me, of course, the brusque way in which he talks, because I became a good friend of his later. Ramurthy, I want you to do a job. I said, yes, sir, what is it? He said, here is a general who is a doctor, who is not well. I understand that you may help him. I said, yes, I would like to do that. Do you want me to come to Delhi? He said, no. I am flying him over to Madras and the details will be given to you by my assistant. Then later on, the assistant talked to me and I found that this was General Rao, who himself was a great doctor, medical doctor, and he was the Director General of the Armed Forces Medical Services, Lieutenant General B.M. Rao. And he had been ill and getting paralysis on one side, and people in Calcutta, Delhi have diagnosed it as brain fever. But somebody thought it may be some brain compression. So they suggested, why not you go to Madras? So they flew him in the president's plane. In those days it was a Viscount. The plane's name also I remember, Rajhams. And we all went to the airport because he was a doctor, a general, and I understood that he was a very senior person in the whole armed forces and an excellent Madras Medical College student because he had got medals and all that years ago. So we received him, and his wife also was a doctor, a radiologist. In those days there was no CT scan and all those things. Then the diagnosis would have been easy. So I brought him at 4:30 a.m. to the general hospital. By 5 o'clock, I had done an angiogram. What angiogram means, you put a needle into the neck, in the blood vessel, in the neck, and injects a dye. The dye goes into the brain and you take pictures. To my great surprise and happiness, I found that this whole problem was due to a huge blood clot which had accumulated outside the brain. Luckily, not inside, not an intracerebral, but outside. So I was very happy because we could remove it, take it out. So by 6:30 in the morning, I had him on the operating table, and it took about 4 hours. By 11 o'clock in the morning, he was back in the ward, and by the afternoon, he began to move his legs.
What was this clot due to, doctor?
This is what's known as a subdural clot. Sometimes in elderly people after the age of 50, 55, even a small injury can make a vein bleed, and it bleeds very slowly. Gradually, the clot goes on accumulating over 2 months, 3 months, 6 months. Then the pressure starts. The patient gets confused. Gradually, the leg or arm becomes weak. And this is the best thing to have in neurosurgery, because once the pressure is removed, the recovery is immediate. So I could telephone to Krishamenan by about 12 noon that General Rao is okay. He was very happy. He said, I'm leaving for New York. I'll keep in touch with you from there. And to my great happiness, I got a phone call from Jawaharlal Nehru in the evening at about 5 o'clock. I was, jitters, but he was very, very nice. He said, I must congratulate you, Dr. Ramurthy. You have done a very good job. I'm happy the general is all right. So thank you, sir. It's very gracious of you to phone. So he recovered very well. And from that time, any problem of neurosurgery in the army, armed forces, army means I include the Navy, the Air Force and the army, armed forces, were all referred to me for a final opinion. So I have been helping so many people. And later on, the 2 wars with Pakistan, the China war also, we had a problem of treatment of brain injuries. So I had suggested that the brain injury should be treated right at the front. You see, what happens is, we don't treat it at the site of injury, and there is a delay of 5 hours, 8 hours, 10 hours in transport, then the brain gets infected. Then they get brain abscess, they get epilepsy, and they become unfit. It's the duty of an army doctor to make the man fit as early as possible and send him back to fight. So what I suggested was that we have a team right in the forward center, and with a small toolbox where all the necessary things will be there. The wound is closed on the spot. We don't deal with the brain and all that. Only the outside wound is sutured, antibiotics given, dressed, and then sent back. This we learnt in Korea, in the Korean War experience. So I introduced it here, and we were able to save a lot of so many small things. So I think the army brass hats in the 70s decided I deserved some honor, and that's why I became an honorary brigadier. So as an honorary brigadier, I could induce more discipline in the NCC of the Madras Medical College. In those days, just watch, 20 years ago, everybody who was anybody came only to the general hospital to get operated. We had all the equipment, we had all the skill, and we had the enthusiasm, we had the motivation, loyalty to the general hospital. So this is an era of up to 1978, when I retired from there. I was a bit cut up at that time, because having served this state to the extent of neglecting everything, I did not know how my sons grew up. I did not know about their education. In fact, my first son suffered from that, because now he is okay. He's one a leading journalist. All that sacrifice, and then for a few days I was cut up. But it was a blessing in disguise, because I was released at the young age of 56. So I could go to VHS and start an entirely new department, entirely new center of excellence in neurosurgery. So that was a blessing in disguise. But sad things should be put very briefly. It's not a question of praising oneself, but what happened after I left the institute was people who succeeded me neither had the competence nor the loyalty to keep up the excellence of the institute. And over the past 10, 12 years, it has gone lower than the ordinary neurosurgical departments in other parts of the country. Only medical neurology is still keeping up the reputation.
At the time that you left, did your whole team also leave?
Gradually they left. After about 3-4 years, degeneration was very gradual, because in my days, even non-medical people had no holiday. All my staff, my stenographers, my photographers, everybody, non-medical people, came on Deepavali Day, they came on Christmas Day, they came on New Year's Day, they came on Sunday.
So you were a hard taskmaster, but
No,
loved at the
I
same
worked
time.
and they all like to work for me.
You set the example.
That's all. See, it is question of how you inspire them. You see. It is like a family, all work together. If you make them feel like that, for instance, when I built the Institute of Neurology, I used to consult everybody, including the ward boys, the stretcher bearers. I used to ask them, how will you bring the stretcher? Should we keep the door here? What do you want the width of the door to be? Then they will say, sir, do it like this. Otherwise, every time we bring the stretcher, we hit that door by this. So, and the nurses, what all they wanted. So, it was, the Institute of Neurology is a labor of love. The engineers, they were all keenly interested in what should be done rightly. So, it was not one man's this one. It was really everybody participated. So, that way, if you come late, if you go home for private practice, nowadays people, I understand, they come only at 10:30 or 11, go away at 1. And even the surgery that is done is of a very ancient variety, which I was doing 40 years ago. Whereas even other centers, smaller centers like Madurai, Salem, have all advanced. Anyway, we should not talk too long about anything that is not good. So now I must come to few more names before I proceed. Dr. Sanjeevi started the scheme of voluntary health services. See, voluntary health services is not a hospital, it is a concept. Dr. Sanjeevi's concept was that people must take health into their own hands. Health is not something which the doctor brings in a suitcase and gives it to you. It is something that you create in yourself, mental happiness and body health. So, he said the villagers must take part in the health services scheme. So, he created these mini health centers. The idea is the people themselves form the health center, not the doctors. The doctors only go to help them. An old lady in the village is chosen as the chief or the president, or old man or old lady who has got respect. And they are made responsible for the health of the people. We tell them what to do. So much so, there has been so much of cooperation from the public that we have not spent a pie on immunization, on child welfare, sterilization, family planning. Everything they did. The old lady used to bring all the children for immunization. No problem. Any girl who was pregnant in the village was brought and given nutrients. And so this caught like the idea, like a wildfire in the village. There are more than 200 centers like this in Tamil Nadu, more than about 100, 150 in Andhra, Karnataka. So this concept of the people taking health into their own hand and helping themselves is the concept of voluntary health services. The hospital that we have here in Madras is the Apex Hospital. So if any community has any medical problem, then they send them over here. Here also what we do is anybody who comes, we register them, and the whole family should come. Even if I go, for instance, with a toothache, then they won't just treat the toothache and let me go. No. I have to bring my family, everybody, servants. All of them are screened for tuberculosis, screened for filariasis, screened for all preventable diseases, and given advice. So you spread public health. This model has to be adopted throughout the country. But doctors do not want to give up the so-called superiority. In this scheme, the doctor is not the superior person. The doctor is only the helper, whereas the village lady, they are the president. So it doesn't catch quickly with the doctors. But there are many doctors who are doing this very willingly. They are giving free service. So
how successful would you say this has been in terms of response?
In terms of response, it's 100% success. Wherever we have kept a mini health center, it has succeeded completely. Then what we do is after some time the VHS gives it over to the village council or the panchayat and they carry it on. Then we go to another center and create. This was the concept of Dr. Sanjeevi. And we just now erected a statue for him in the VHS and we could talk about his contribution to society. So I joined the VHS and again I was able to get about 8 lakhs of rupees from my father-in-law's trust, Arogya Ashram Samiti, and built a new block for neurosurgery. Now, today the neurosurgery department in VHS is quite well known. We have got a postgraduate center, we have got all the modern equipment and able to serve the public with the latest neurosurgical facilities. In the meantime, we progressed very well in international relationship. India became very well recognized in neurosurgery. I started the Neurological Society of India in 1951. We are only 4 of us members. Dr. Chandy from Vellore, myself, Dr. S.T. Narasimhan, about already talked, and Dr. Baldev Singh, very senior neurologist from Delhi. From membership of 4, now it is 1,500 people now. And from nothing in those days, Indian neurosurgery and neurology have grown so much in skill, service and importance, world importance, that we were able to invite the world meeting, World Federation of Neurosurgeons and Neurologists, both, to New Delhi in 1989. It was a grand occasion. We had, in those days still there was Soviet Union, not Russia. And first time we had 40 delegates from Russia and 30 delegates from China attending any international meeting. Till then, all the world congresses, only 1 or 2 will come. But for India, we had these people in large numbers. I was the president and it was one of the excellent congresses. See, we were very worried knowing Indian attitudes, Indian mores, Jane do, Parwanai, Kal hoga. This attitude, I said, how are we going to conduct an international congress with efficiency? But there was this Dr. Tandon and Dr. Banerjee. These are the 2 famous names in Delhi in neurosurgery. The excellent department in the All India Institute. Today, the best department in India is the All India Institute Neurosurgery Department. This Dr. Banerjee was the Secretary General. And he arranged everything so well that no lecture started even 1 minute later. Suppose 8 a.m. was the program during the Congress. There are 8 halls. All of them started on time. No slide was shown upside down and no delay in any function. And the social content was, of course, in India, all congresses are very well organized socially, culturally. But the efficiency was so much, I was amazed. The last day at the executive meeting, of all people, the German delegation led a standing ovation for us. Imagine the Germans who are the most efficient, congratulating Indians on their efficiency.
Must have been a thrilling moment.
I felt on top of the world. It was really, I must thank the Dr. Banerjee and the Delhi people. That means the Indian can be efficient, can be excellent if he wants to. Then what is it that prevents us from wanting to? That always amazes me, surprises me.
I think he needs motivation all the time.
Why can't we be motivated? Because in India, in any field you take, in business, in administration, in science, excellent people. But why can't all of us be excellent? I think that is a thing that we should discuss sometime.